Are you fearful of the dentist? Do you have dental phobias, apprehension? Are you one of those individuals, or you've heard people who say, I hate the dentist. I hate the dentist. Well, one of the reasons why they hate the dentist is because of having to get numb, right? Maybe scared of the needle or just whatever that phobia is. Well, today we're going to talk to a dental student who just matched into dental anesthesia. Yes, dental anesthesia, which is like the sleep dentists. We're sleep dentists, right? We have the solutions to successfully making sure that we can help you conquer that apprehension. And she's going to tell us all about how she matched into the program. She's going to also tell us about how she put together her application, how she ranked her program, how she did her interviews, all that and more. So stay tuned. Hey, this is Dr. Darwin, a new dentist coach, for another episode of Ask Dr. Darwin on the New Dentist Podcast Show, where we talk about getting into dental school, getting into residency, and then life as a new dentist. Be sure you're continuing to share this content, comment, save it for later, go back, use it as part of your process to get into residency. Also, this episode is being brought to you by GetIntoDentalResidencyChallenge.com, the ultimate resource to help you jumpstart your application process for residency. For more details, go to the link down below, okay? And join the next challenge. Today, we're talking with special guest who is recently successfully just matched into probably one of the well, it is definitely the one of the newest dental specialties, but also one of the dental specialties that's very, very competitive. Today, we're joined with student Dr. Sydnye Fields, who's on the countdown. She's got two countdowns. She's got completion of dental school as a countdown, but she also has a countdown into launching her career as a dental anesthesiologist. Doc, how you doing today?
I'm good. How are you? Thank you for having me.
I'm fine. I'm great. I'm great. Please tell us a little bit more about yourself for those that may be meeting you for the first time as well.
Yes, sir. So my name is Sydney Fields. I'm from Houston, Texas. I'm a fourth year dental student currently at the Woody L. Hunt Texas Tech School of Dental Medicine. My dental school was a brand new dental school that just opened in 2021, and I will be a member of the first graduating class. So the inaugural class here at Tech. I was a former college volleyball player. I attended the University of North Carolina at Chapel Hill for 3 years, and I played volleyball there for 3 years. And then I ended up transferring my junior year to Texas A&M, and I completed my collegiate career playing at Texas A&M. I studied chemistry and Spanish, and I graduated in 2015. Wait, did I graduate in 2015? 2019, sorry. I graduated high school in 2015, 2019. I hope you can edit that out.
Yeah, yeah. Hey, I get it. You know, as a volleyball player, jumping up and down, your brain is moving, going left and right. You can't remember some of the things. I get it. Same thing happened to me running track at college. I get it. I don't remember everything. So H-Town, Houston.
Yes, sir.
Oh, awesome. Lived there for a while. Love Houston. And UNC, I went to UVA, ACC rivals.
Okay.
So that's great. That's great. Outside of that, the only other thing we have in common is Spanish. Yo hablo español solamente un poquito, but chemistry, nah. Can't say we have that in common. But that's great, Doc. Let's talk
That's
about
great.
schools and programs. We know there are 10 programs. Tell us a little bit about your strategy as far as the number of schools that you apply to and why those programs.
Of course. So out of the 10 programs, like you mentioned, there's one program in Canada. And so I knew that I wanted to go to a program that was salary based. You get paid since you're a hospital employee. And so that program is tuition based if you are not a Canadian resident. I believe if I'm incorrect, someone can maybe correct me in the comments. But so I didn't apply to that program. And then that would leave nine. And then out of those nine, there's two programs that you have to have a year of work experience or have done a GPR to apply. And obviously, I was applying straight through as a dental student, so I didn't apply to those two. So that left seven. And I applied to all of those seven programs. So there are three programs in New York: Jacobi Medical Center, NYU Langone, and Stony Brook in Long Island. And then Advocate Illinois Masonic Medical Center is located in Chicago, University of Pittsburgh, and the Ohio State University. And then the seventh program is a brand new program that just opened this year. Their PGY1 class will be starting in 2025, and that is University of Las Vegas, Nevada, so UNLV. And so that was a brand new program for my application cycle, but I applied to that program as well. So those were the seven.
Awesome. UNLV. I didn't know they came on with a new program. I was familiar with the three in New York, Pittsburgh, also Chicago and Ohio State, but UNLV. That's great. That's great. So basically you just applied to all the programs. It
Yeah,
wasn't
from
necessary.
what
I
I
mean, that was your
heard,
strategy. Yeah, that was your
yeah,
strategy.
what I heard, it looks bad if you like, oh, I really want to go to Pitt, and so I'm only going to apply to Pitt. I'm only going to extern at Pitt. So it's just better to apply everywhere. Um, and so, yeah, I mean, there's only seven and there's very few spots. So I wanted to apply, like I said, everywhere and give myself just the best chance.
Yeah, that
So I would
sounds
say
good.
that's pretty standard. I do have some colleagues that did match, and like certain areas might have been like a deal breaker for their family that they didn't want to move to that area, maybe their spouse or something like that, so they didn't apply to that program. But for the most part, I enjoyed all my externships at all the programs, and I I was willing to do whatever, move wherever I needed to be to get this job. So
And that's key that you mentioned that as it relates to doing whatever it takes, right? Especially when you get that direct information from residents or program directors, or you see how being in that environment at the ASDA conference, you can see how what the vibe is and what the energy is, right? Those people are determined, colleagues that are that will do whatever it takes. So being in that environment also gives you a sense of the type of behavior and thought process and mindset that you need to have to get yourself ready for the application, especially externships. And externships, again, are key because not only does it help with your application, personal statement, but also things that are in your CV, right? But also, those externships are going to help probably what we love to hear now is some advice, some tips, knowing what you know now, and you've gone through this process, and you've already shared some great inputs and some great things about your process and things that you did during that process, right? Especially the externship piece and going to the meeting. What else? What else should individuals who are aspiring to become a dental anesthesiologist, what are, a couple of things or a few things that they must do right now?
I think the first thing I would say before you start worrying about CBSE or externing or, going to ASDA is just finding a finding a mentor, finding somebody to shadow. Dr. Kromash, one of the first things he told me when I was at the ASDA conference and talking with him was, I want a resident that is willing to give up dentistry and become an anesthesiologist, because it is a very, very different field. And he said, I want someone who's okay with that and understands that and is willing to give it up. Because even though you are trained as a dentist, you're not doing the dentistry and you're not doing this and the sedation at the same time. So I think finding a mentor, shadowing, seeing what it's really like. I had a classmate who was interested, and she came with me to Houston to shadow my mentor, and she was like, wow, like this is not what I thought this was at all, or like this is not what I was expecting. She was like, it's really cool, and I'm actually really glad that I came, but like this is not what I thought it was. So I think shadowing, having a relationship with someone that, you can ask questions and like follow them and understand what they're doing to realize about the field is really important. And also, one of the things that they look for is having a letter of recommendation from a dentist anesthesiologist, at least two. So, if you know someone that is an MD anesthesiologist and works in a hospital and you ask them for a letter of rec, like it's not going to be held as highly as having a letter of rec from a DA. So having a good relationship with them, shadowing them really knowing you over a period of time to write you a good letter versus, you going once or twice and being like, hey, can you write me a letter, rec? I think it's important. Um, and then just starting early, like even if you think you're interested and you're not really sure, like starting early and maybe attending the conference, the fee for a student is only $100, like a student pricing to attend. So I think just going, meeting people, asking questions to like figure out, because like I said, I still was kind of on the cusp, like, oh, maybe I should give ortho a chance. So I think finding a mentor, shadowing, documenting your shadowing hours and keeping track, and then just starting as early as possible, whether it is just like initial interest to see, or if it's like, okay, I think I'm set on this and like starting studying early. Like, I wish I would have started like first day of dental school, which is what some of my classmates who are doing OMFS did. I'm like seeing them walk around with first aid as first years. I'm like, what are these kids doing? And they're like, they know that they want to be oral surgeons and, they're on it because that test is a beast for sure.
Yeah.
So,
Yeah. And you mentioned it earlier, as far as that test, and I'm sure that's part of some advice as well, making sure that you are utilizing those resources specifically geared to support your studying for the test, right?
mhm,
You mentioned Sketchy, you mentioned UWorld, you mentioned Patholoma, you mentioned the National Board Medical Exam forms, the old
mhm,
exams as well. And I'm sure that's also part of some tips and advice. The sooner you can get your hands on those resources and start to prepare your candidacy related to your test, the
mhm,
exam, because like you said, this is something new that anesthesia is doing as a way of determining where you're going to be and be able to excel within the profession. Because like you said, right, it's not dentistry anymore, right? It's
mhm,
not dentistry anymore. So, some great tips: finding a mentor, shadowing, letters of recommendations from specifically from dental
mhm,
anesthesiologists, and how that has a much heavier weight, or it's weighted heavier, as part of the program directors and the faculty that are reviewing those applications. And then again, starting early, like you mentioned, D1, D2 year where you went to the conference. And yes, you must go to the conference. You must go to the conference. Anything else you can think of that maybe you had done that you wish you had done just slightly different?
um, I'm trying to think. Like, I only knew to go to the conference because when I was shadowing in LA, I met a resident that was like working there. Um, and so he was the one I asked him, because NYU, they have two external sites. They send their residents to LA and they send their residents to Arizona to do external rotations there. And so,
Mm,
like, had I not got specifically connected and like there was a resident there and asked, I wouldn't have known to do that. So that's why I definitely say like that. I started externing in like March. Like I started
hmm.
really early because I went to both external sites. I went to LA, I went to Arizona, and then I went to all the programs also. So yeah, I mean, I started early. I'm trying to think anything that I would have done different. Um,
Well, not too much different because you matched, right? You matched. So evidently everything that you did was spot on, and it got you the end result, right? Um, do have a question about this last thing, and it's a tip as well. See if you can fill in complete the sentence. Do not do anesthesia if you are blank, or
if
do
you
not consider becoming a dental anesthesiologist if you are blank.
if you can't handle pressure, I would say. But
Mm,
um yeah, I think one of the reasons why I said like shadowing a DA first and like really understanding what it is, since a lot of DAs work in mobile, you're not in a hospital setting. So should an emergency arise, granted, you are in somebody's office. So you're seeing kids that are ASA ones and twos, like kids that are fairly healthy, not people that are extremely sick, because if they were extremely sick, they would be being seen in the hospital in the first place. But emergencies do happen, anything can happen. So, if something happens in someone's office, you're not in the hospital where you can just press a button and you have a team of nurses or other doctors running in to support you in handling that medical emergency. So, um, if you don't think that you're the type of person that can handle the stress of being in an office, something happens, and the dentist, the dental assistant, the dental hygienist, the office staff, they're all looking at you because you are trained as an anesthesiologist and they're wanting you to be like, okay, what do we do? For some people, that's like very scary. And they're like, oh, I would never do that. Like, you got that, Sydney. Like, that's all you. But
Right.
I think I would say don't do that if you don't think that you can handle the pressure. But on the flip side of that, I will say that, you are trained in these ORs and you are doing these cases with people that are very sick. And you do learn everything that you need to know to be able to handle that should it arise. Because my dad asked me the same thing. He's like, do you think that you can do this? I'm like, yeah, like I totally can do this. I know that I can do this and I will do it. So I would say if you're the type of person that you're like, that's too much stress for me, someone's life is in my hands, quite literally and physically, then this probably isn't the job for you.
Yeah, yeah. Bye, Felicia. Don't even think about it. Don't even think about it. And I think there's another one that you mentioned via your program director, right? It sounds like doing dental anesthesia is not for individuals who want to continue doing clinical dentistry as well.
Yeah, for sure. I would say majority of DAs do not do dentistry anymore. I do know my program director, his wife is a pediatric dentist. So on Monday through Wednesdays, he's working like at their office. And then on Thursdays and Fridays, we're in the dental clinic with him doing sedation with the GPR residents. One of my other mentors, his old business partner, would see patients like a couple days out of the week and then do sedation the other days. My mentor is thinking about opening, an office and starting doing some implants and stuff like that on some days of the week. But I would say it's pretty typical that you don't do dentistry anymore. I know that I will not be doing dentistry anymore. Um, but if it's something that's like you're super passionate about and you still like really are interested in doing it, it is possible. Like you still have your DDS or DMD and you're able to, but I would say like 95% do not. 90. We'll
Yeah,
go 90.
yeah. So there you go. 5 great tips about launching your career, your future career as a dental anesthesiologist, and very helpful. Very helpful. What's the best way for people to get in contact with you if they want to get some more help or want to pick your brain about maybe how you studied and the resources and your other conversations that you've had throughout this process and applying and your journey to dental anesthesia? What's the best way for people to contact you?
They could email me. I'll give my personal email since I won't be graduating, or I'll be graduating from school. I won't have my Texas Tech email. So it's just my name, Sydney, spelled SYDNYEF, as in Frank, at gmail.com. My name is spelled very uniquely. So it's not Sydney EY, it's Sydney YE. And then I've also just had a lot of people reach out to me and message me on Instagram. I'm pretty active on there. My name currently is Sid Fills, SYDFILLS. In May, when I graduate, I'll be changing my name to Sedation, so it won't be Sid Fills anymore. But yeah, I would say email or Instagram is fine. I have responded to everyone that's reached out or tried to. If there's someone that DM me and I didn't answer, please message me again. But yeah, I think like I'm very passionate about pre-dental students and like just helping people in general, because I feel like when I applied to dental school, I didn't necessarily have that. I didn't know a lot about dental school. I didn't really know what I was doing besides pre-dental society and our volleyball team advisor, who was just like, these are the prerequisite courses, girl. Like, that's all I can tell you. And
Right.
so I just aspire to be the person that I wish I had. And so whether that's for dental school or for residency for anesthesia, I had a lot of great advice from my future co-resident. But I also just reached out to him on Instagram and I was like, hey, can I ask you some questions? So I think
Yeah.
that's why I go so hard, is just because I want to help people and everybody can reach their dreams. And if I'm able to be a part of that process, then that's amazing. So.
That's right. Well, you are part of the process. You're doing it and you're helping people right now who listened and who probably need to do 2 things. Number one, go back and listen supplement your notes with all this good information and value that Dr. Fields have shared with us. And then the second thing is go to the next episode. Go to the next episode right now. Go, go.